Donc, bonjour à tous, bienvenue à cette conférence de presse sur la situation de la COVID-19 au Québec. Aujourd'hui, le Premier ministre du Québec, M. François Legault.
Today, the Premier of Quebec, Mr. François Legault, is together with the National Director of Public Health of Quebec, Dr. Horacio Arruda, and the Minister of Health and Social Services, Mr. Christian Dubé. The Premier will speak first, and then Mr. Dubé, and then we'll take the questions of the journalists. Mr. Premier.
Bonjour tout le monde.
Hello everyone. First, I wish to take advantage of this since it is my first press conference of the year to wish all Quebecers a happy New Year 2021. Of course, wishing one another's health is more appropriate than ever. So what I wish for you and what I wish for ourselves is to be able, by the end of the year, to see our families, extended families, or friends. Me first. I mean, I miss those Friday evenings having dinner with friends or with extended family members. So we all wish to be able to, by December, to be able to start once again, being able to see them and having a more normal life, in quotes, despite the fact that what happened with the pandemic is going to change a lot of things in our lives permanently, and we'll be able to talk about it later. Of course, the past year has not been easy. We have had the battle of our lives, if we could say, and unfortunately, this battle is not yet over, and we'll have to say the truth. In the past few weeks, the situation of the pandemic has worsened. So we've seen an increase in the number of cases, an increase in the number of hospitalizations. The death toll is increasing. We have seen our hospitals get overloaded. So the situation is really critical. It is serious. And as Premier, one of my first responsibilities is to ensure the safety of citizens, of Quebecers. And so, yes, together with my team, I must take decisions that are difficult. And that, of course, to protect those more vulnerable amongst us, to protect our healthcare network. But there's no perfect solution. So although we really try to study dozens of scenarios, at some point in each scenario there are disadvantages, for example, with mental health, so we've tried to find a balance. The first thing that we asked ourselves, and I'm convinced that it is perhaps the question that many Quebecers are asking themselves as well today, is why? Why, with all the efforts that we have been making, particularly in the past 2 weeks, why, with the schools that are closed, with most businesses closed, how is it that there are so many new cases every day? And the answer is hard. It's that it happened a lot in people's homes. So a lot of people, amongst them more vulnerable people, more elderly people, were contaminated in their own homes and ended up at the hospital. So faced with this, we are forced today to announce a sort of shock therapy in order to reduce the number of visits in homes. And that is why I'm announcing today that as of Saturday and for 4 weeks, we will have a curfew in Quebec from 8 p.m. to 5 o'clock in the morning. So that is, apart from going to work, people will not be able to be outside of their homes between 8 p.m. and 5 a.m. So from the 9th of January until the 8th of February. Unfortunately, as well, we have to continue with the lockdown in certain sectors. Offices, working from home will be continuing to be mandatory. Businesses that are deemed to be non-essential will continue being closed. and all of this until the 8th of February. The only change that we are bringing in the business sector is that curbside pickup will be allowed. So somebody who wants to go and buy a coat, for example, a winter coat, at the door of a store will be able to do so. That will allow certain people to get things that they need and to certain stores to sell a little bit. But of course, we understand quite well that it is very limited. As far as grocery stores and debts are concerned, taking into account the curfew, which is at 8 p.m., we ask all grocery stores and all debts to close at 7:30 p.m. to then give people the time to get home. We are making one exception, and that is for debts where there is a gas station as well. And there are also pharmacies will be able to be open after 8 p.m. Unfortunately, restaurants, gyms, theaters, cinemas are also going to remain closed until the 8th of February. So when we say that we're giving a shock therapy here, it really is for 4 weeks. It is a period that should allow us to make a difference. And an important detail, because we've received calls in the past few days, in the past few hours, filming of movies and series, taking into account that it is framed with guidelines, they will continue. I think that is important, even if it's, just to be able to distract ourselves a little bit, those are allowed to go on. Places of worship, we know that up until now, people could be 25. Now it will be forbidden, since in certain places it had created problems. The only exception we'll be making is for funerals. So for funerals, we will be allowing those, but limiting them to 10 people. Now, a few subjects that were very debated: schools. Of course, it is very hard when we talk about the schools. It is a harrowing decision. We have to look at what is happening. In the past few months, there's been outbreaks in some classrooms, perhaps 2 or 3% of classrooms only, but there are outbreaks. And however, I've said it before and I repeat it, for me, it is the priority, keeping schools opened. We owe it to our young people. We owe it to our children. Our children have to be able to continue learning. So we have agreed together with public health that as planned, schools, primary schools will be opening Monday on the 11th of January as had been planned. That change that we've made, and that comes to help for the potential problems that aerosols might bring about, we will be asking the children to wear a mask or a face covering, should I rather say, in the hallways. And students of 5th and 6th grade will need to wear a face covering in the classroom. Of course, there's also the entire question of airing things out. There will be a press conference tomorrow from the Minister of Education in order to tell you about it. For high school, since it is possible to teach well online, which is a lot more difficult at the primary level, we have agreed to do online teaching for a further week. So in secondary schools, classes will start on the 18th of January, but we will be, the government that is, will be supplying 2 procedural masks, exactly like the one that I have right now, per day, to each student and each teacher, so in all high schools in Quebec. So all students in high school will have to wear a procedural mask. We have enough of them and we can supply them to everyone. Once again, I'd like to repeat it. Jean-François Roberge will be doing a press conference on Friday. Did I say Thursday? I meant Friday. So the day after tomorrow. And we've worked a lot in the past few weeks and few days on 3 subjects. First, mentoring for students who are having difficulties, and of course, these students, since they weren't in class, perhaps they need even more help than they would have. And there's a second subject that has to do with the entire school reorganization, for example, the weighing of the exams, the content, the teaching content, that is the second section. And the third section are measures to help. And those will be announced by Jean-François for those children who have mental health problems. We know that the fact that children have been more isolated and have been living a life that has been very particular in the past 10 months. Therefore, there will be measures that will be added. Also, another measure that indirectly will affect our students, everything having to do with municipal libraries. So, of course, it's important, not everybody knew it, but already going to a municipal library is allowed to go borrow books. However, what was not possible was to go study at the library. Now we will be allowing it while respecting physical distancing. People will be able to go study in municipal libraries. The objective that we are targeting is to allow children who don't have high-speed Wi-Fi at home to have access to it in municipal libraries, and also to have, in certain cases, a quiet place to be able to study and to read. Concerning outside activities, we talked about that a lot. That is also a very fragile balance between physical health and mental health. So we have chosen to leave, to allow all individual outside activities. So we don't want, for example, getting ski lessons won't be possible, but going skiing, taking a walk, cross-country skiing, skating, without it being organized teams, that will all be possible. But one must remain within one's household bubble. And maybe a word on mental health. I'm very conscious of it, and I've talked about it, that the measures have a negative impact on mental health. And that is why we wish to keep activities open outside. But I just wish to say that Minister Lionel Carman has worked really hard since the beginning of the pandemic. We've added over 300 employees, and the waiting lists are decreasing. So do not hesitate to ask for services. And here I'm talking about everyone, not just young people who are having difficulties with their mental health. Now, I also wish to talk to you about people 65 years and over. I'm 63, so I will very soon be targeted by this, and I don't wish to stigmatize people who are 65 years and older, but you will see later on, Christian has a chart that is very meaningful. I'm sure that you've heard before about the 20/80 rule. Well, it is applicable in this case. People who are 65 years and over represent 20% of the Quebec population, but they represent 80% of people who are hospitalized because of COVID. So that's a fact. If we wish to make efforts to reduce hospitalizations and to reduce the death toll, we have to protect those people who are 65 years and over much better. What that means concretely, and I'm making a call out first to those people who are 65 years and over. I don't wish to deny you freedom, but it is important as much as possible to remain at home and to not take any chances. And I also wish to speak to all those people who are not 65. Please be careful. It's not the time to take risks and to go contaminate your mom or your grandfather. It's easy. We've seen it. We have 2,500 plus cases per day, so the virus is being transmitted very easily. And in many cases, it is transmitted in people's homes. So be really careful. We have to make a special effort for the 4 upcoming weeks with those people who are 65 and over. And amongst others, I wish to clarify this. I understand that in certain cases, for practical reasons, grandparents, it happens where they might go babysit one of their grandchildren, and that is not a good idea. It's not a good idea because children, yes, have a lot less risk of having serious consequences of the disease, but they can transmit the disease to their grandmother, to their grandfather, so it is not a good idea to have your children be babysit by people who are 65 and over. So what we are asking Quebecers is to say that apart from working, apart from going to school, apart from getting food, you have to stay at home. And going out for a walk, and it's possible to do so before 8 p.m. When I hear people say, oh, well, I won't be able to go walk anymore. Well, come on. If you want to work a little bit later, you can work after 8 p.m. at home. But I think that it is possible, and it's also something that is good to go out for a walk. But it is important in the following 4 weeks to really make an effort. We're talking here about saving lives, and we're talking about saving our healthcare system. And a word on police officers. First, I wish to be quite clear. Geneviève Guilbeault is going to be having a press conference tomorrow to explain what she is asking of police officers. But what we are asking police officers is to have the guidelines respected. That means that those people, for example, who are outside of their home in the evening after 8 p.m. with no reason, could get a fine between $1,000 and $6,000. And we've asked police officers because I think that if we wish for Quebecers to respect the guidelines, we have to send a very clear message that other Quebecers, whether they be your neighbors, people elsewhere in other regions, well, they have to be doing the same thing. They also have to respect the guidelines, and if they don't, well, there are consequences. And I wish to take advantage of this to thank police officers. Police officers are really important allies in the fight against the virus, and for the past 10 months, they've been at the front, day after day. They've been doing work that is not easy, but we need to support them. And I need, Quebec needs the police officers in order to be able to succeed with this shock treatment in the following 4 weeks. And perhaps just a word, later on, Christian is going to add a word on vaccines, but I really do wish to clear things up. Unlike what Justin Trudeau said, all the vaccines that we receive every week are used every week. When Justin Trudeau says to us we're going to be sending the provinces 1.2 million doses by the end of January, that is for all provinces. That means 233,000 doses for Quebec by the end of January. We can use that many in a week. We can do 250,000 in a week, so there is no problem. We could be vaccinating 4 times more people than we are right now, but we don't have enough doses. So I wish to send out a message that is very clear to Justin Trudeau. Instead of telling provinces what to do on standards in CHSLDs and on vaccines, well, he could, first of all, supply us the vaccines more quickly, and he could also better control the follow-up with those travelers who are coming back to Canada. So I would like to conclude by saying that the upcoming month is going to be a critical one. We are here in a sort of race, and unfortunately, we have lost this race in the past few weeks, but we can win it, but we have to make the efforts, and that is why today we are announcing this shock therapy, and it is to save lives, I repeat that, and to save our healthcare system. So, right now, for the following month, we are in the worst of the fight. We're in the thick of it. And now is when we have to reduce contagion. So I count on all Quebecers. I count on you. Thank you for your efforts.
Good evening, everyone. In recent weeks, the pandemic has worsened around the world, including here in Quebec. The situation in our hospitals is critical, especially in Montreal. There are still too many visits in homes. That's why I'm announcing that starting next Saturday, there'll be a curfew from 8 p.m. to 5 a.m. during 4 weeks. So after 8 p.m., We won't be allowed to go out in streets except for work. During the day, we also need to reduce contacts in houses. Many non-essential activities will also continue to be closed until February the 8th. It'll be mandatory to work from home for office workers. All non-essential businesses as well as places of worship will remain closed until February the 8th. Funerals will be authorized for a maximum of 10 people. Groceries will have to close at 7:30 p.m. Pharmacies and gas stations will be allowed to stay open. Regarding schools, I think it's essential that children continue to learn, so we'll reopen primary schools on January the 11th as planned. But all children will have to wear a mask outside the classroom, and children in 5th and 6th grade will have to wear a mask in the classroom. Secondary or high schools will continue online and reopen on January the 11th. All teachers and students will have to wear a procedural mask. We'll distribute 2 masks per day to everyone in every school. Regarding libraries, it's already allowed to borrow books. From January 11, children will be also allowed to go there to study. Outside activities will still be allowed as long as it's with people in your bubble. I know those measures are tough for our mental health, but we have to balance that with the situation in our hospitals. The situation is very serious. The virus is especially dangerous for people over the age of 65. I ask them to be very careful and to stay home as much as possible. We all need to stay home as much as possible for the next 4 weeks. Police officers will be there to make sure everybody respects the rules. We see the light at the end of the tunnel with the vaccine, but we need to reduce the contagion right now, and I'm counting on you all. Thank you. Je passe maintenant la parole au ministre de la Santé.
To the Minister for Health, Mr. Christian Dubé. So hello, everyone. So to go over the vaccination, because if there is good news to be said today, it is the execution that we'll be conducting over the following weeks about the vaccination. So we have prepared a chart here, which is available on our website, and I would like to summarize it for you here. I don't know if on TV you are able to see it, but I am going to try to reveal the 4 main components. So first, I'd like to reiterate the point that the Premier just made. All the doses that we will be receiving will be used in the days after, because we are able to do it. And I repeat it, the experience that we had with the flu, we can vaccinate right now with our team 250,000 people per week. So they can send doses from the federal government, can send us doses, we can take it. Now, I'm summarizing here the chart in 4 components. The first is to make sure that people can understand the categories of people that we wish to vaccinate over the upcoming months. This is aligned with the cycle. Remember the Commission of Immunization, but also the recommendations of public health that is putting the emphasis on CHSLDs and the different people that we wish to vaccinate, and you already know about this. The second is to be able to say now the effort that we're asking from people today for the coming months, where will that bring us in a month's time? So I'd like to show you right away that if you take the fact that we would have vaccinated the totality of people in CHSLDs who are our most vulnerable, and a good portion of people who are in the healthcare network, plus a significant portion of RPAs, those private retirement homes, it would mean that by the 8th of February, we would already have vaccinated 250,000 people. So 250,000 people as of the 8th of February, and that is why we have the link here with the lockdown period. So that would already be fixing a very important problem to help not only with the death toll, but in the graph that I'll show you later, those people who are in our hospitals and who create the congestion that we have right now. What it is interesting to note as well, and I'll end with that, is that when we follow, and I think it's important for the public, and that's why I want to repeat it, and that is why the Premier also said it, not only can we vaccinate, but we could even vaccinate more. So I wish to reassure the population, each dose that is showed by the federal government and that is going to be made available to us, we are going to be indicating them every week on our website and every day, as we have started doing since the very beginning, since the first day of vaccination. And I want to repeat it, we are going to be updating the number that you see here, which as of yesterday, for the vaccination that ended by the end of the day, we already had 38,000 people who had been vaccinated. And that is as of the first vaccine that we received. So people will be able to see the link and the efficacy in the vaccination efforts. One last comment on that, without going too much into details, I would like to remind everyone that just yesterday, we vaccinated over 6,000 people. 6,000, if we put it over a month, we're already close to the 200,000 in a month, and we have not yet reached our cruising speed. So that is why I want to say we are capable of vaccinating, and that is what I want to end with. Thank you, Christian. We will now be going to the question period. So one question and one follow-up question.
Et je vous prierai, s'il vous plaît, de bien vouloir indiquer à qui votre question s'adresse. On va d'abord débuter avec Alain Laforêt de TVA Nouvelles.
Bonjour, Monsieur le Premier ministre. Est-ce que vous m'entendez?
Hello, Mr. Premier. Can you hear me? Yes, very well. So the ultimate measure, Mr. Premier, is the curfew. It is quite clear that today we're asking ourselves the question, is it because you feel that the healthcare network might be within the next month or two to have to make choices about who to treat and who not to treat of those affected by COVID? Well, that is precisely what we wish to avoid. We don't want to have to make those choices. I was seeing articles yesterday saying that in LA, which is not a small city, where they have to make those kinds of choices. For the time being, we do not believe that we'll have to be making choices between patients, but we are taking these measures in order not to get there. People who live alone, Mr. Premier, there's a lot of worry. There are people who are wondering today, are they going to be alone for the next month? It was allowed to be able to meet friends outside, and now it would seem that in your guidelines that is no longer allowed. You have to stay in your bubble, so no question of, no possibility of getting together with friends to do activities outside. Is that correct? Well, first, people who live alone can still have one person alone as visitors, but I ask them to be very careful, so mask and remain 2 meters away. Now, outside, it was not possible, and it is still not possible to be, for a good while in the company of somebody who is not in your family or household bubble, so who didn't have the same residence. There's no change to that.
Merci. On va passer à Sébastien Beauvais de Radio-Canada.
Bonjour, messieurs. Est-ce que vous m'entendez bien?
Oui, on
Can
vous
you hear
entend
me,
bien, Monsieur
gentlemen?
Beauvais.
Yes, we
Excusez-moi,
can.
j'étais sur mute.
I'm sorry, I was on mute. This is now become a classic. I would like to know what the science is behind the efficacy of a curfew. Why are you threatening people taking walks in the evening to get a fine? What will that change in the fight against COVID? The measures that we set up for COVID are cumulative. There is no science that can tell you that such and such a measure will have such and such percentage of efficacy. It has to be understood, and now I wish to say this, that if there have been as many cases that have maintained themselves, we've managed to stabilize with an increase that is rising rapidly. It means that there have been contacts, there have been gatherings. We have to be clear with that, and our objective is not to criticize or penalize or anything like that. And I'm going to talk about people who have symptoms and who have to go and get checked. What the curfew does is it gives a signal, but it also allows to decrease activities and possibilities of contacts that might continue.
after a certain time. So if you ask me, is there a controlled study that shows that? The answer is no. But we have to be able to adopt measures which altogether will decrease the probability of gatherings or contacts. People over the holiday period probably did not have any big parties, but everybody had gatherings with families or brother-in-law, and it is that sum that brings about a tremendous amount of effects. A small number will bring many cases, and because of community transmission, which right now is everywhere, it's even more significant. So I would like to take advantage of the fact that I'm speaking to say one thing. People have decreased distancing, they don't wear the mask as well, they don't wash their hands. We have to start with those things again as we did it intensively in the spring. If you have symptoms right now, there's no flu in Quebec. So if you have symptoms that look like the flu, it is probably COVID-19. We ask you to isolate yourselves quickly, to go get a test, because now we feel that people don't get tested anymore, and to wait for the results on the part of public health. If the people from public health call you to ask you whether you've had any contacts, there are people right now who don't want to say because they're scared that they're going to be declared to public safety or they're going to have fines. We're not there to yell at you or to annoy you. We are there to lower the transmission cycle. So it is a duty right now to do physical distancing, to wear the mask, to do the basic hygiene, to respect all the guidelines, and to collaborate with public health so that we can break the transmission cycle. It's a question of life and death, of maintaining care. We don't want to get for people to die of a stroke because they weren't able to go to emergency or anything like that. Please, it is very serious. And thankfully, the vaccine is there to help us, as Mr. Minister was saying. We can see hope now. We'll protect our elderly, we'll protect our healthcare workers, but please also make the necessary efforts. Mr. Legault, this is a peripheral issue, but it does strike people's minds. You're asking Quebecers to go home and ask them to sacrifice, and some people are wondering how they're going to pay bills. You're authorizing multimillionaires from the Canadiens de Montréal to practice their sport and to continue their lives as if everything was normal. How can you explain this, what would appear to be an incoherence? Well, I was talking about, filming series. I think a lot of Quebecers look forward to be able to watch hockey on television. According to the schedule that was filed by the National League, the games will start on the 13th of February. The Canadiens starts against the Maple Leafs in Toronto, but there is no game in Montreal before the 27th of January. The people from the Montreal Canadiens had long discussions with public health. There are very strict guidelines that have been set up, so there will be no spectators. People will be tested every day. They will be forced to be home. They will not be able to visit anybody else, etc., etc. So I think that Quebecers wish to have television series and hockey games, and it is done in a completely safe way. And they have the means to be able to pay for that safety.
Bonjour, m'entendez-vous?
Oui, très bien.
Hello, Mr. Legault. Listen, I have not heard you on two very important sectors, that is, construction and manufacturing. These two sectors where outbreaks have been very numerous in the past months. So I'd like to know what is happening with these two sectors that are very important. What we are doing with construction and the manufacturing sector, first it has to be understood that in the spring, Quebec was about the only place in the world that closed down those two sectors. And they didn't close that down anywhere in other countries or in Ontario, first. Second, there are many products that are essential in the manufacturing sector. So they make products that we consume that are essential. So what we are asking companies in the manufacturing and construction sectors is to delay the production of everything that is not deemed to be essential. However, they can continue operating to produce what is essential. As far as the measures for schools is concerned, we've heard you say that it is still your priority. So basically, primary schools, the return to class is not going to be delayed, but there will be extra measures. For example, wearing a mask for those in grade 5 or 6, and for high schoolers as well, there's additional measures. I would like to know whether those measures, is it until the 8th of February, or will they be up until the end of the school year, or for a longer period at any rate? I think that as long as the transmission is intensive, people will have to apply the measures. I think that this is pretty clear. It has to be understood that these measures first, in every activity sector, whether it be manufacturing or others, we have to reinforce our prevention messages, because there is a bit of a slackening off. You know, it's not natural to wear a mask and be 2 meters away from other people, etc. So the measures will be maintained as long as there is intensive spread and that we won't have reached an adequate vaccination percentage. I think that it's reinforcement, and in high schools, the procedural mask, which is easier, which protects better, is going to be an add-on, and in the context where there's a lot of circulation in the community, a lot of spread.
Bonjour à tous les trois, vous m'entendez bien?
Oui, on vous entend bien.
I would like to know, Mr. Legault, what is your game plan for the homeless? Where are they supposed to go at 8 p.m.? What do they do when they meet police officers after that time? Well, we talked about it this morning, and what we wish is for the homeless to also be inside. So there are places that are planned for, and of course what we wish, particularly with the cold, we wish for them to be inside. And there's enough room available for them. Mr. Dubé, immunology specialists say that you should backtrack to give the second dose of vaccination according to what is suggested and what is planned for, and there's also ethics problems and possible mutations of the virus. So in light of that information, might you review that decision? And second, would it be the same if the healthcare system was not very close to being overloaded right now and close to a breaking point? Well, first, I want you to know that, as always, we've based ourselves on the recommendations of public health. There was a debate in the first few weeks because there were requirements by Pfizer to keep the second dose, but when that was clarified, we made the decision that had to be made, and I think that if Dr. Arruda wishes to comment, I can allow him to complete. It has to be understood that we're in a pandemic and people are dying right now, and I wish to say that in Quebec, we've already done work on what we call modified calendars with what the companies recommend, and it has given adequate results. We don't make a decision like that by just getting up in the morning one morning. You know, what the committee has done for Quebec, other countries have made recommendations. In England, they're doing the same thing. So we believe that protecting as many people as possible in the short term is going to save lives in a very significant manner, and that the people who have received one dose, at least for a certain period of time, which is going to go beyond the 21 days, that's for sure, are going to have that protection. So in a context of public health and a pandemic, we're not in a usual situation. There are people dying every day. The more people at high risk we protect over short term, the more lives we will save. As far as the period where we give the second dose, we will be following. There will be studies, we'll do research, and we will adjust for the question of the second dose. But it seems to me that here, saving lives in Quebec in general is more important than individual protection, which is present right now, because one dose does give pretty adequate protection. A question for the Premier. Is it only because of the federal, if so few Quebecers have been vaccinated up until now, or does your government have a part of responsibility in how slowly the vaccination is going on? What I said, and I repeat it, every week, during the week, we get doses, and in the week following the reception of these, they are used So right now, we have been vaccinating about 40,000, so 6,000 per day times 7, 42,000. So we could vaccinate 250,000 people per week rather than 42,000. So we wish to get more, and right now we find that it's insufficient, getting only 233,000 by the end of January. As a follow-up, will there be roadblocks to respect? Well, the police officers already have a lot to do, a lot of things where they have to keep their eye on things. So we're making a choice that it is not a priority to see about inter-regional travel. Of course, we continue saying that it's not a good idea, but we prefer that police officers make sure that the other guidelines are being followed, because these are the ones that people can get fined for.
Bonjour, messieurs, est-ce que vous m'entendez?
Oui, très bien.
Fantastique. Alors, Monsieur le Premier ministre,
Mr. Premier, my first question. If I've understood correctly, the curfew will be imposed all over Quebec, but the situation is different from one region to the next. In the Côte-Nord, for example, I've noticed that in the past 3 days there's only been one single case of COVID-19 that was added. So why not proceed regionally, depending on people's particular situation? The only region that will be excluded is northern Quebec, because when we look at the different regions right now and when we look at the hospital capacity, we consider that there is risk in every single region right now. So we do not consider that there should be different measures except for the greater northern area of Quebec. My second question, the curfew, it's not just the grocery employees or DEPs, there's all sorts of workers in Quebec that end after 8 p.m., people from the healthcare network, public transportation, etc. Will those people have to have a letter from their employer to prove to a police officer that might stop them that they have the right to be outside because they're coming back from work and they're going home? Well, first, yes, you're right. There are many workers, for example, those in the public transportation sector who work after 8 p.m. and who will be able to move around after 8 p.m. For the time being, there's no document, but we are working right now at setting up a document in order to ease the work of police officers. But as of Saturday, police officers will be able to stop people who are outside after 8 p.m. and ask them questions. And Mr. Premier, together with the question that was asked, why are we doing it everywhere? Perhaps it is time to clarify, as you had wished, on the hospitalizations, because I think that we have to remind ourselves that one of the reasons why we are making all these efforts that are even more significant in the upcoming weeks is because of the hospitalizations. And earlier on, the Premier, if you'll give me a couple of minutes, we have made a very detailed analysis over the past few weeks and months of the number of cases that we have on a daily basis. And what you can see here is a very simple representation of 3 categories. That is, I'll call them the children or teenagers, people 17 years of age and less. And you can see the lowering in number of cases when we get closer to the 2nd of January, and that's normal. That's a closure of schools. But there have been some cases. The important part here is the 18 to 64, we'll call them the workers mainly. And here at the top you have people who are 65 and over. So the 3 categories that we often say, 65 to 74, 75 and over, and 85 and over. So what you can see very well here is that it's relatively stable, with an increase in the workers here and a lowering in the students here. That's the first point. But the second graph, which I think is very important to show, is to understand that the category of the 20% of the population, I go back to the numbers that the Premier mentioned, look at the change in colors here. So I told you earlier on that the 65 years and over who represent about 20% of people who are contaminated with COVID-19, they represent about 80% of people who are at the hospital. And that is quite clear when you make that comparison. And I wish to remind everyone that these charts are available on our website. What it is important to keep in mind as well is that these people here, and we can see it, it's pretty stable in terms of proportion. But the second conclusion, so the rule, the 80-20 rule is applicable. So 20% of the population represent 80% of cases. But why are we doing the lockdown? It's because of this third chart. And for me, it's really important. And we can see why have we seen this change over the past few weeks. If you look, still the same three categories of people, that is to say, the blue line are our children, 0 to 17. We went, when we had about 1,000 cases per day, so this was back in November, we had about, for those children, 200, 250 cases per day, which was the cases in the schools. And for the elderly, we had about 200, 250. Going towards 2,500 cases, we can see that there's been an increase. We went from 200 to 300, 400 cases, but look at the 18 to 64 years of age category. That is where the community spread is. These are our workers who went from 700 to close to 1,800 people, and look at the peaks over the holiday period. So when we say that, yes, we have to protect the most vulnerable amongst ourselves, those are the ones that are at the hospital. But this category of people, for all sorts of reasons, either because of work or visits or babysitting, they are the ones that are creating the contagion, the spread between these two groups. So if we summarize, yes, we are doing it for the hospitalizations and for our elderly, but we have to stop with this spread right here, which is the community spread. And I repeated these graphs. We're going to be keeping a very close eye on these over the past few weeks, because that is what we want to see lower if we wish to be able to reduce the numbers of hospitalizations.
Oui, allô, vous m'entendez bien?
Oui.
I would like to start by talking about two sectors that we haven't heard much today, museums and daycares. What about these two sectors? Will there be more measures? What is going to happen over the following weeks? The museums will continue being closed, and daycares will continue being opened. There are no changes in these two sectors. Thank you. Now, Mr. Dubé and Mr. Arruda, I'd like to come back to the aerosols. Mr. Legault, earlier on you said that there was going to be a press conference on that the day after tomorrow, but I would like to hear a little bit more, because at the beginning of the week there were hundreds of experts and scientists who were asking the government to recognize the role of aerosol spread and to integrate it in the strategy. So what are you planning on doing in schools, for example, beyond the mask? As far as ventilation is concerned, what is it you're planning on doing to address this problem? Well, as we said, we are going over the literature. We've looked at everything that's been published in terms of ventilation element and aerosols in order to see in what care context there might be improvements brought in the school sector, etc. I don't want to go into details. I don't want to comment before the report is published, but we have truly made the analysis to see what could be done in the context of Quebec. So I think that the information will be coming in the upcoming days. Dr. Massé Houdok with the interministerial group will be able to answer all those questions.
On va passer à Émilie Pelletier, Le Soleil.
Oui, bonjour messieurs, vous m'entendez bien?
Oui, très bien.
Donc, bonjour à vous trois. Peut-être, Monsieur Legault, j'aimerais
Mr. Legault, I would like to hear you. We talked about the case of tests people who live alone, I'm sorry, they can receive one visit. But what about visits for people in CHSLDs or private retirement homes? What I would like to say is that, first of all, the rules that we have set up, generally speaking, for the holiday period, those continue. That is the basic principle. What I would like to bring as a clarification is that we don't want to leave people alone, and those people have to be able to get a visit. The only difference that we'll be making is that as far as CHSLDs are concerned, and I would say particularly for caregivers, what is very important, and we've talked about it a lot with Minister Marguerite Blais to make sure that we would be doing it correctly to protect that principle. What we are going to be doing is to give access to 2 caregivers because the period is pretty lengthy. We're talking about a month, so that caregivers be able to relay one another visiting a person in a CHSLDs. In the case of RPAs, or other homes, we're talking about RIs, that is intermediary resources. What we want is for the same principle, that it be one person at a time. We ask that as much as possible the number of visits be limited, but it can be different people. But what we want is one person at a time per 24-hour period. Yes, and what has to be understood is that we are in a very intense transmission period right now. As the Premier was saying, be careful with the elderly and, try not to expose yourselves. The vaccine is coming soon for you. I think that is the hope that you can keep. And one of the elements that we had allowed is that, you could go out into a family household bubble. That was for the holiday period, to be able to have, dinner with a family. So it was one caregiver or 2 that can come and visit with, keeping distancing and a mask. What might happen in certain residences for the elderly is that the cafeteria services will no longer be made at the cafeteria. People will have service in their own unit to avoid contacts, taking into account that there's such a spread. It's, there's a lot of spread outside, so it can go into those homes. So it is that 4-week period that we're asking. And please, be careful, take care of yourselves, because we would like for the vaccine to be able to help you to get many years of life and not lose them because of a lack of care right now. My second question, maybe for Mr. Dubé or Mr. Arruda, has to do with the specific case that we saw here at the National Capital area. You probably saw that there was at Saint-Antoine, a worker of the Saint-Antoine who lost his life on the 2nd of January. He had not been vaccinated, but there are groups of workers who are still saying that they wish to have N95 masks because some caregivers are still getting infected despite the mask. So is that being examined to have perhaps a pilot project to see about people in CHSLDs wearing N95 masks? Well, as I told you, there is a report that will be given on aerosols, ventilation, and the recommendation of what we call our infection prevention committees. They're going to be giving us the information. If ever there's an improvement, N95 masks are usually recommended in situations where there are aerosols. N95 masks are very difficult to wear all day. But we are, of course, going to adapt our practices if necessary, depending on the expert advice. It's ongoing right now, and we'll get that information in the upcoming days. Hello, gentlemen. Mr. Legault, right now there are 700 and over 650 outbreaks in workplaces, active outbreaks. What explains that number, despite the fact that you've asked, and you asked this in mid-December, you asked businesses to proceed to mandatory working from home? Well, on the question of outbreaks, and as you know, this is something that we are following very closely, in certain outbreaks, particularly in work environments. The good news is that it's not so much now the number of outbreaks that is increasing. On the contrary, I think that there's a certain stabilization. It's the number of cases within those outbreaks. And we'll be able to supply statistics because we have been following very closely. So what I would answer, and that is why we are going to try to make the measures inside businesses stricter, because the businesses that are following the measures very strictly, we can see that when there is an outbreak, we limit the number of cases. And that is what is important. It's not so much the outbreak in and of itself, but the number of cases that follow it. So what I would say, after that analysis that very detailed analysis that we made before receiving the recommendations of public health, now we have to go back, and that is why we are going to involve the CNES once again, the Commission for Health and Safety at Work, to make sure that on all sites, whether it be in terms of construction or manufacturing, that our employers, whether it be small, medium, large, that they come back with the measures in order to make sure that the measures are followed. So it's not just the number of outbreaks, but the cases that have increased. And that is what we have to keep an eye on. I also wish to insist on the fact that we have to become very rigorous again in our approach of the following weeks, because just as in everything else, it's easy to slacken off and to say that the problem isn't there. But I can tell you that the manufacturing sector that has the most outbreaks are sectors that unfortunately we cannot close, like in the agri-food business or slaughterhouses. And when there's so much transmission in the community, it's normal that cases even be caught outside and arrive at the workplace. What is important is that it doesn't create a big outbreak. So, there's a lot of outbreaks, it's true, but if they're small and controllable, it's not so bad. Could you show your first chart, Mr. Dubé, the first one that you showed us on the vaccination? I couldn't see it very well, but I would like to know, for the first and second categories of prioritization, when will the second doses be administered? And if I understood correctly, it seemed to have been in March. Does not go beyond the 6 weeks that the WHO is asking for? Well, you're right, but first, the WHO, well, first, if you'll remember, it was the people who got vaccinated was in the week of the 14th of December and the 21st of December, particularly in CHSLDs, and for the staff. But once again, I'd like to repeat that information is available on our website. Now, what we plan on doing for the time being, and depending as well on the number of doses that we'll be receiving, because I think that the message of the federal government is that we receive more, we'll be able to vaccinate more quickly. We could even accelerate the second doses that you can see here. That is why the color is different. But I'd like to repeat it right now. There are discussions being held with public health, and depending on the speed at which we can give the vaccine to those most vulnerable people, we'll be able to accelerate the second dose as needed. We are ready for different scenarios. So 3 more questions in French.
Oui, allô, est-ce que vous m'entendez?
Oui.
Bonjour, Silvio Morin, chef des nouvelles dans Bourse.com.
Bonjour, Monsieur Morin.
My question is for you, Mr. Premier. I'd like to come back to the curfew. You said, will there be forms or will there be means of preparing oneself ahead of time so that as of Saturday, for example, we, the media, if there's a fire somewhere at 9 p.m. on Boulevard La Croix, that we be able to do our work, and for other people in the public as well. Is that already ready? Or is that something that you're planning for? Because otherwise we might risk having problems with police officers if we get intercepted. No, I think that police officers are going to be understanding, but they will require good reasons for people to be outside after 8 p.m. But we're looking at the possibility, it's not going to be ready on Saturday, but we're looking at the possibility of having documents in order to ease and accelerate the work of police officers. You didn't say it, perhaps it's obvious, but I'd still like to ask you the question. We, the media, are we still considered to be an essential service? Can we continue doing our work without problems? Well, yes, of course. Journalists are an essential service. So, okay, I just wanted to make sure that we're not going to get into trouble by doing things illegally.
François Legault de Mediat. Est-ce que ça fonctionne, François?
Is it working? I'd like to go back to the regions. We've talked about a curfew, but we went from green to yellow and orange in the past few months. Today, are all regions considered red, the ones that were still orange? Well, listen, if I can answer that question, I'd like to bring that back to hospitalizations. I said that there are regions, very specific ones, that are already very problematic. I'm thinking, for example, of the Montérégie, the Montreal area, Laval. There are regions right now where we're very close to the breaking point, or we've already started to have to leave more procedures aside. In those regions that you're talking about, we might not be at such a critical juncture, but if we add 100 or 120 hospitalizations every day, we might reach problems in those zones very quickly. So it's not just the number of cases that is important, it is the hospital situation. And it can become very serious in certain regions, such as in Montreal, that we might need the help of certain regions in order to move staff around to be able to help us. I'm just going to give you one example that I don't like to give, but just so that it is quite concrete. This morning, Dr. O'Patterney gave the order to stop kidney operations. Just to give you an idea, if you want to have a concrete example of what COVID is doing for non-COVID patients, we now have to stop kidney transplants because we need beds to do that. So I think that we don't need to give you more details than that. We need, for the entire network that has been close to the breaking point for many months, that is working with extraordinary staff, they're asking us for help, and our way of helping them is to bring that back as quickly as possible to a number of manageable cases, and that is why all regions of Quebec have to work together in this. So that means that restaurants are closing down, everything that was still opened in regions, it's all closing down? Yes.
Parfait, donc on va passer maintenant à Maxime Coursol, in media.
Est-ce que vous m'entendez bien? Oui. Parfait. Bonjour, Monsieur le Premier ministre.
Hello, Mr. Premier.
Ma question concerne la région des
has to do with the Laurentians region,
ainsi que les autres régions
as well as other tourist regions in Quebec. We understand that individual activities will be allowed, for example, skiing. Isn't there a risk that on ski hills there will be many people who would be coming to take advantage of the fresh air that we can find in the Laurentians? We did ask ourselves the question, yes, the eastern townships, the Charlevoix region, there are people from other regions that go there. It's not ideal, as we were saying, to go from one region to another. But as far as skiing is concerned, with the guidelines that have been set up right now, if we, for example, don't allow lessons with many children and a monitor, if it's just skiing in Tremblant, we consider that it is possible to do that with guidelines that would be done, and it's good for people's mental health. So we did ask ourselves the question, and I know that there might be people in Mont-Tremblant, but I think it is possible to do it safely.
Merci beaucoup. Ma sous-question concernerait les garderies.
The follow-up is
Je me demandais,
daycares. I was
j'ai
wondering.
cru comprendre que les garderies
I thought I understood that daycares were considered to be an essential service, like schools and all that. But in the case where both people in a couple are working because they're in essential services, I understand that their child can go to daycare. Well, first, all daycares remain open. So those that already had a spot in a daycare, whether they be essential service or not, they will continue sending their child in the daycare. Now, as of Monday, primary schools will open with all the services that go along with it. So I think that takes care of that problem. We will now be going to English questions.
Just raise your hands on the application. The first question that I see is from Aaron Derfel from Montreal Gazette.
Yes, Mr. Premier Legault, what are the precise conditions that you will require to start lifting the restrictions? Specifically in terms of hospitalizations and cases. How many cases and hospitalizations have to go down? To what level do they have to drop for you to have confidence to lift the restrictions?
I think we have to be careful to have only one figure to lift the restrictions. First, you have to look at the situation of the hospitals in a particular region. You also have to look at the trend. You have to look at the percentage of people that are positive in this region. So there are many indicators that we have to watch. There's not only one.
Yes, and my supplementary question is on the subject of the curfew. Experts are saying that there are still lots of outbreaks in manufacturing, and we know that there are cases among workers from 18 to 64. What will a curfew do to solve the problem of transmission among workers in the workplace, especially in manufacturing?
Okay, first we have to remember that 80% of the people that are in our hospitals because of the COVID-19, they are 65 years old or more. So most of them, they don't work in the manufacturing business. Second, many of the activities in the manufacturing business are essential activities, like all the food that is made is essential. So I think right now, yes, there are some challenges, especially in the abattoir, but it's a situation where we need to put in place some measures with the CNE SST to make sure that the workers wear masks, that they keep 2 meters between the different workers. But we cannot consider at this point to close those essential businesses.
And I may add that it's not because we are doing a confinement, I don't know exactly the name in English, I'm sorry. It's not because we are using it that we must relax on the other things. That's, I would say, a very important, that everything we do should be respected and rigorous. So it's why I'm telling you, even at work, we will have to make sure that you do the job the best way you were supposed to do it. Not having dinners with your colleagues with no masks, and because that is a way of transmission. So it's not because we had this that the other things are not important. We are doing something else to lower the quantity of contacts that could be happening in the society.
Just a reminder that if you don't raise your hands on the application, I won't give you the question. So next we have the Canadian Press. It's Mr. Cerebra.
Good evening.
Good evening.
Do you worry that, I've spoken to some, I think many people have spoken to experts that say, the problem is, in factories. I spoke to one expert today who said he doesn't believe it's possible for gatherings in homes to be responsible for 2,500 cases a day in Quebec. Do you worry that we're going to get into a situation where we impose these strong measures and we don't get the results we'd like to see?
But I want to repeat what I said before. Right now, 80% of the people in our hospitals because of the COVID, they are 65 years old or more. So we cannot consider that most of them are working in the manufacturing business. Some of them work in manufacturing businesses, but there are some essential services. I think that we really have to be very careful when we meet people over 65 years old.
And for my follow-up, there was some mention earlier that factories would be asked to postpone non-essential activities. Can you explain sort of who's going to decide that and how that's going to work?
But we did it during the spring. I think it will be a discussion between public health and the different companies and the CNE SST. I don't expect much problem on that.
Donc, on a une dernière question de CBC. C'est Simon Nakoneci qui nous l'a envoyé. Il ne peut pas participer à la période de questions, malheureusement. Je vais vous lire la question en français, mais la réponse doit venir en anglais.
I will read you the question in French. The question is the following. There are different doctors and experts who have said that more strict measures should have been adopted weeks or months ago. Since September, you've announced the 28-day challenge. There are thousands of Quebecers who have been hospitalized. Many have died already, thousands. So why have you not announced these measures earlier on?
The world forecasted the actual situation. I think that we were one of the places in the world where we have the most restrictions. We had to go gradually, and right now, today, we announce more measures. We're again, one of the first to put in place these kind of measures. So I think that if somebody had the possibility of seeing that we would have 2,500 cases a day today, they are a magician.
Et finalement, on a une dernière question de Gloria Enriquez de Global News qui vient de lever sa main sur l'application. So, Gloria, your question?
Good evening. How many more people will be vaccinated by February 8th, and will they have one dose or both doses?
First, they'll have a single dose, and by February the 8th, the target is to have approximately 250,000 people vaccinated.
Thank you. And my second question is, a pediatrician at the Montreal Children's says the number of tests is overwhelming and of great concern. What do you think about his post showing boxes upon boxes of tests waiting to be analyzed? Is it too little too late now?
I apologize. I'm not sure if I understood correctly your question. Would you mind repeating it, please?
Yes. A pediatrician at the Montreal Children's says the number of tests is overwhelming and of great concern. What do you think about his post showing boxes and boxes of tests waiting to be analyzed? Do you think that these measures are coming a little too late?
No, first of all, we had the capacity to go even to 40,000 tests. Recently, even in Christmas time, it goes lower to 20,000 tests sometimes. So we have a capacity, and when there is more, we still have a small backlog, but by one day or two, it's eliminated. So I think, and unless I would tell you, and we always prioritize the ones which have a higher risk of being positive. So actually, the testing capacity is not an issue based on the data that we have every day. Sometimes when there is a big peak of tests in one day because people present, there could be, we'd say, more tests waiting for analysis. But most of the time, by 48 hours, they have been tested. So we need probably to see what is exactly that comment that you had.
But maybe to give you ballpark figures, we right now analyze about between 25 and 35,000 a day. We have a couple of thousand of backlog, and we're doing more per capita than the Ontario and most of the places. So I don't see what you refer to.
Can I just add one thing? I just looked at our statistics, and the backlog as of this morning was 1,400, which is very low. 1,400 means that we will clear those tests in the next day. So the backlog is normal.
Merci beaucoup. C'est ce qui met fin à la conférence de presse.
Thank you very much. This puts an end to the press conference. Thank you, everyone. Have a great evening and take care. Be careful. 1 month.